First, good to see you. All is well. I hope on your side also.
Baruch Hashem, everyone's great. What about you?
Hodu Hashem, just excellent. Okay. So tonight we're going to be speaking about Niddah issues leading up to labor and during labor itself. We're having just a little issue, just for 1 second. The password's not working because on the flyer it's a little short. So I'm just passing that on. With that said, I'm often asked by my patients to inform them when they are Niddah as an OBGYN. Different things happen during the course of pregnancy and certainly in labor itself that brings up this issue. And it's been a very confusing topic to me during the course of my career because many Rabbanim have different ideas and different ways of determining Niddah. And I really have to, and I try to speak to this specific Rav about that specific patient when issues come up, because it isn't cut and dry up and down the line.
Right.
Basically all halachic questions that come up with specific patients, again, I found it's my way of doing things. I want to speak to their Rav, not my Rav. I want to speak to their Rav to see what their Rav paskins for them. And it's my understanding, just to start off the conversation about Niddah, that there are 3 basic things that make a patient a Niddah in labor. If they saw blood, if the patient can't walk, and if the patient is sitting on the birthing stool to deliver. So with that, I'll ask Rabbi Segelman to just give us a little background on those 3 statements, what they actually mean, and how do we determine them?
Perfect. So I think the best way to start is asking ourselves, number one, why is there so much, I don't want to say confusion, but why is there a wide array of different psukim from various Rabbanim? Okay, that's not a crazy question. We know throughout Halacha there are different stances on different issues, but specifically when it comes to labor and Niddah, there really is a lot of ambiguity. The reason for that ambiguity is because Chazal was ambiguous. So I'll start with the 3rd thing that you mentioned, and that's the birthing stool. Chazal don't give us a precise moment in time where a woman in labor is a Niddah. They use terms like Yosheves al Hamashber, when she sits on the birthing stool. So at that point, she's going to be a Niddah, or at that point, really, she's a chola, she's a yoledes, and therefore for Shabbos, she has a different halachic status, etc. And we kind of extrapolate from other sugyas and apply it to Niddah, and we would say, well, if she's a yoledes, she's a birthing mother, insofar as Shabbos is concerned, so reasonable to assume that is insofar as Niddah is concerned as well. There are those who argue, but the basic idea that Chazal was trying to portray was when a woman is, I think the phrase we would use is when she's in active labor. That when a woman is in active labor, then she would be considered a Niddah. Now, before I go on, I'll throw it back to you. When you tell a woman you're in active labor, what do you mean? Or when would you tell a woman, looks like you're in active labor? What does that look like from a physician's perspective?
That's exactly what was going through my mind, because patients always ask me, when did labor begin? And I said, you're asking me a very difficult question. We know that if you're contracting, you're having regular contractions, that does not equal labor, or else we would only have one word. We have 2 words. What is labor? Contractions that cause dilation. Right. So how do we know when that happened. We don't. We know when you dilated already.
Mhm.
So it had to have happened before we figured it out. Contractions, contractions, contractions. I didn't check you for the last hour, 2 hours, or 3 hours. When I checked you, you weren't very dilated. And then I came back and I checked you and now you're very dilated. You go, when did labor begin? I go, between those 2 points, but I can't tell you when it began.
Right. So halachically as well, it's difficult to pinpoint the exact moment of labor insofar as Niddah is concerned. And therefore, different Rabbanim have different kind of different stages of what we would call active labor. Some poskim, you didn't mention the water breaking. I'm sure we'll get there, but some poskim would say even as early as the water breaking. That's a siman, that's an indicator that we have entered the realm of active labor, so like the Gemara was referring to. The Gemara doesn't say, Yeridas Hamayim, but the Gemara talks about active labor. So if the water breaking would be considered the earliest point, the onset, the commencement of active labor, so then she would be a Niddah. Other poskim look to more of a general kind of, how is she feeling? Can she walk? Can she talk? How are the contractions? So that's really what those Rabbanim are, where they're coming from, trying to pinpoint a time where we could reasonably assume that if she was in the times of Chazal, this would be a time where we would say, okay, why don't you sit down on your birthing stool and let's go push. Some Rabbanim are so literal that they will not allow the woman, they won't deem the woman or render the woman a Niddah until she's physically sitting on the birthing stool when the doctor says push, because that's, after all, what the Gemara says, Yosheves ala mashber, when she's sitting on that birthing stool. So, and you find really all of the different shittas in between those two outliers. So I'm happy to hear your next question, but just as a background, we have to go into this presentation, knowing that even Chazal gave us an ambiguous and vague terminology to define that point of Niddah during labor.
Okay, so I call these the big three: seeing blood, unable to walk, and sitting on the birthing stool. We'll talk about the others coming up because we're going to talk about specific cases or ideas. So let's go.
I had just one more thing I forgot to mention. Seeing blood is usually a scary thing, especially in the world of Niddah. Seeing blood is a red flag, right? That being said, as I'm sure many of us are aware, not all blood will render a woman a Niddah. If a doctor can tell us unequivocally that the blood that was seen for whatever reason was cervical, was vaginal, and was not uterine, so then blood may not be such a culprit. It's true in conjunction with active labor, blood is usually a telltale sign, but it's also important to know that we must identify the nature of the blood before jumping to any conclusions.
Okay, so my first question would be seeing blood. And let's say, again, we're going to talk about a woman who's in the hospital. She came in because she's in labor. The contractions are strong. Who sees the blood? If I see the blood, does that render her a Niddah? Or does she have to see the blood to render herself a Niddah? If I examine and I see blood on my glove, and I take the glove and I throw it in the garbage, and she says, "Did you see blood, doctor?" And I say, "Don't ask me such questions."
Yeah.
Is she? Do we look at her as a Niddah? It's the same blood, but blood that I see versus blood that she sees. Is there?
It's a good question. It's a very good question. Now, and you're raising a very, very, very important point. Because in this discussion of when a woman becomes a Niddah, often blood on the glove, at least from a Rav's perspective, and when a Rav is speaking to a couple, or a couple they're preparing for what to expect in the hospital as they go in, in their 9th month, they go in for labor. So they're not really expecting to see blood on the glove. However, as I'm sure you know, I mean, I'm interested to hear your numbers, but how many patients come into the hospital, and obviously one of the first things that you do is to check them to see how dilated they are, to see where they're holding in terms of their labor. So how often is it that blood would appear on the glove?
Very often. If
Okay.
again, understanding they came in, I'm contracting, I'm in labor, they're painful. I listened to your instructions and I came in.
Understood. So now, just to veer off slightly, I don't want to get too detailed in Hilchos Niddah, but within the world of Hilchos Niddah, if a woman is inserting, let's say, a bedika cloth into the vaginal canal, and she takes the bedika cloth out, and there is blood, or a woman inserts a tampon, and the woman takes the tampon out, and there is blood, or she inserts her finger into the vagina, and she takes her finger out, and there is blood. So generally speaking, that blood will render her a niddah, unless we are able to verify completely and absolutely that that blood did not come from the uterus, but rather it came from the vaginal canal or it came from the cervix. Similarly, if a doctor sticks his finger into the vagina with a glove, pulls out the finger, and there's blood on the glove, so at first glance, that blood would render her a niddah. Now, it's possible that in order for the doctor to get an accurate read on how many centimeters dilated she is, there may be some type of cervical wound or cervical trauma that could cause bleeding. However, the doctor at that point is also unable, you can correct me if I'm wrong, the doctor is unable to unequivocally say there is no bleeding from the uterus. You could say it's likely that the blood that's on my glove is a cervical traumatic wound because I was just poking around in there. But can I tell you for sure that there's no bleeding from the uterus? No. So I'm a little bit hesitant to be makel and to say that a woman is not a niddah if A, the doctor doesn't know 100% that they caused the wound. It's just reasonable, right? And we don't know for sure that there's no dam coming from the uterus. So therefore, and I've spoken to many rabbanim about this, therefore, if a woman goes into the hospital and the doctor examines her and finds blood on the glove, that would in fact render her a niddah. Now, the question that you asked, I would say as follows. If you saw blood, I think it would be important to inform the patient that you saw blood. That being said, you are not obligated to examine your glove. So if you do an exam and you pull out and train yourself to look up as you take the glove off and discard it, then we do not have to assume there was blood. But if blood was spotted, blood was found and identified, then I do think it's important to tell.
So I should inform her that I saw blood if I see blood, even if she doesn't ask me.
I think so. I think so.
Okay. So but
you shouldn't look.
Let me just see if this is okay. It's not important. It's a doctor, but he could wait for us to finish. Okay.
But what would happen if someone called in labor right now?
It's Dr. Wallach would go to the hospital. If it was my niece, then I would go to the hospital. But right now, there's no niece expected to be in labor at the moment.
Good. Okay, let's go on.
Okay. The second is that she can't walk. So I'm going to ask you, what is the reason that she can't walk? And I'll give you a couple of things that happen to a patient. They have pain. The pain is so severe that they can't walk. And they're basically you roll into labor and delivery in a wheelchair. This labor is terrible. I can't walk. That's one case. Another case that I had was a patient who came in. The baby is coming. The baby is coming. I can't walk. This is the most terrible pain, I'm telling you. And we check her and she's not dilated at all. And I sent her from the hospital to the physical therapist. He adjusted her and she went away pain-free. But if you listen to her, she was howling, it's coming, the baby is coming out, I'm in pain. Okay. How about if she's been up for 30 hours and she's so tired that she can't walk? So I just gave you 3 different scenarios of can't walk, and how do we touch each one of those up?
It's a good question. I think it boils down to what is the reason why a woman who is Yosheves al Hamashber a Niddah, and the answer is because that is considered active labor. So when Rabbanim use this indicator as can't walk, it's an example or a manifestation, an expression of intense labor, intense active labor, which has commenced, you're so far into your labor experience that you can't walk, but because of the labor, because the baby is coming out, because you're in active labor. A woman who is very tired, a woman who is very tired, a woman who doesn't deal with pain well, her pain tolerance level is low. I do not think that would be the most appropriate indicator for her to determine whether or not she's a Niddah. I think at this point it's important to mention that the fact that there's so much ambiguity and the fact that there's so much quote unquote confusion, it's important to know that Rabbanim have a window to work with, and it's important that Rabbanim should treat each patient with the with the care that patient needs, the halachic care that patient needs. And this is a perfect example. If a Rav knows that a woman is very anxious and she is doesn't tolerate pain well, and she is very emotional, and he feels that if a woman were to come and say, I can't walk, but that's not necessarily a fair manifestation or expression of what's actually going on, then maybe he should look to a different level or a different stage of the labor to determine whether or not she's in Niddah at that point. I think that's an important tool that Rabbanim have to work with, to recognize who they're talking to, who they're the couple that that's asking the shaila, and to know when to be machmer, when to be mekel, also as different things arise.
Just again to express my confusion, I'm the one who's asked to make that determination at 3 o'clock in the morning.
To determine whether or not the fact that she can't walk, is that because of the labor?
No, I'm saying the husband carries the wife into the hospital. She's screaming. She can't walk. The pain is so severe. And he asked me, is she a Niddah? And I usually would answer, let me examine her first.
Right.
And then I examine her.
Yeah.
And she's 2 centimeters dilated on her first baby.
Right.
Okay. So
another important question to ask her to see is she contracting? Like, what's the nature of her contractions? So if she can't walk, but her contractions are not as intense as you would want them before delivering her baby, so that's also another indicator that maybe this is a pain tolerance issue, and this is not necessarily an accurate indication that active labor has commenced.
So before we move on to specific or non-specific cases, the last one is, again, of our big 3 is sitting on the mashpir, sitting on the birthing stool. And I mean, according to, again, a few things, does she actually have to be pushing at that point? Is that the definition of sitting on the mashpir, or the labor is so intense that I need to be in bed?
Yeah. She's ready to be put on that bed, and she's ready to push. You don't need to actually push. Most posts can assume that Yosheves al Hamashber is not a literal point of time, but it is a description of that window of time. Someone just texted me, by the way, that they can't get in because our meeting is maxed at 100 participants. So
wonderful.
For next time, I'll grow our room. I'll put more chairs in the room.
With that said, 3 years ago, I remember on an Erev Shabbos, I got done seeing patients, and we had a patient in labor, so I went to the hospital to find that she was on her hands and knees on the floor, rocking back and forth, with my nurse rubbing her back for her. And she said, this is the way I deliver. I think it was her 3rd baby. And she says, when it's time to give birth, I'll let you know, and I'll get in the bed and I'll push at that point. And without medications, she went through the entire labor. And I'm looking at my watch saying, Shabbos is coming, Shabbos is coming. And 2 hours before Shabbos, she says, I'm ready. And she got in the bed and pushed once or twice and gave birth.
Wow.
Early, she saw no blood the entire labor. No one checked her. She said, she'll tell me, there's no reason for me to check. She was able to walk the entire way through. And the only time that she was ready was she's sitting on the mashpir. I'll tell you, it's time to push. So it's actually, we could get all the way down to the end in certain cases where none of the other indicators make her a Niddah. And I guess she only became a Niddah at that point.
Yep.
All these cases do happen, in very different ways. Okay, so I always like to do a timeline, start from sort of before we get to the hospital and just work through a couple of cases. So I wrote them down so we get through them easily. A patient who's 39 weeks pregnant calls me on the phone and says she's contracting every 5 minutes and that she's in labor. So I said, okay, go to the hospital. I would say we don't determine that she's a Niddah at that point. She didn't give me any other information or anything leading to that. And her husband could help her physically into the hospital. So Niddah, yes or no? I would say
the
no.
only consideration at that point would be the contractions. Again, there are some poskim who assume that intense contractions is called active labor that would render her a Niddah. If she has contractions every 5 minutes apart and they're really, really, really intense, I've seen poskim say between 3 and 5 minutes.
So when I speak to the patients, certainly on a first baby, I give them instructions 3 weeks before they're due. And I say to them on a first baby, if you say to your husband, I think I'm contracting, stay home. If you tell your husband, I'm definitely contracting, but they don't hurt me, stay home. If you tell your husband, shoot me, kill me, I never felt anything so strong in my life, get in the car and come to the hospital.
Give me a call, yeah.
On a second baby or third baby or 11th baby, I say, when you turn to your husband and say, dear, I'm in labor, you go to the hospital.
Yeah.
So in this case, I'm assuming, because I'm making the rules, the patient is calling me because she's saying they're 5 minutes apart, but I'm telling you I'm in labor, or these are the strongest contractions, that I've ever felt, and I need to go to the hospital.
Right. So, another answer that I would throw into this whole parsha is a nuanced answer, just like this whole question is a nuanced question and a little bit of an ambiguous and vague question. And when you ask a question, me, is she a Niddah, yes or no? So my answer may be, it depends. And what does it depend on? It depends on what type of activity are we looking to permit or prohibit. You asked, is the husband able to help her into the car? So it could be that some shittas out there would say, yes, she's a Niddah because of the nature of her contractions. Other shittas would say she's not yet a Niddah because she's not at an advanced stage in her labor. Now that might be enough for me to tell her, halachically, medically also, it's probably not a good idea for them to engage in tashmish. But it might be enough for me to say, halachically, this couple should not have tashmish. If you're asking me if she's a Niddah vis-a-vis intercourse, I would tell you, don't have tashmish. If you're asking me, do I have enough to rely on that the husband can help her into the car? At that point, I would say yes. And I think that's an important perspective as we go closer to the hospital, getting it from the car into the hospital, pushing the wheelchair if there's no one else to push her. At each and every juncture, you ask yourself, at this point, given her medical situation and the activity that I'm interested in doing, can the two align? Can I kiss her? Might be different than can I help her out of the taxi? So I may say, yes, you can help her out of the taxi. I may say you should avoid kissing her at that point because kissing her is intimate behavior. And maybe she has entered Niddah, at least according to some to some shitas. So there's another nuanced halachic approach to this difficult question.
Next, a patient who's 39 weeks pregnant, a week before the due date. She comes to the office for a checkup and she requests to be checked. Today, I've gone away from checking. I do not check patients in general every week right before their due date. I'm much more interested in is the head down, which I look on the ultrasound and I see on the ultrasound. So it removed the idea that I need to check them. And is there, I determine they're not in labor, but there are patients who ask me, could you please check me to see if I'm dilated? Okay, and I said, if that's what your request is, I will check you. So I check her and she's 2 centimeters dilated, but not effaced. So long cervix, 2 centimeters. So again, she's open. She hasn't reported any bleeding. She's not in labor as far as I'm concerned. I'm not sending her to the hospital. And she asked me, I go, you could walk around another 2 weeks like this, 2 centimeters dilated. Again, in my view, if she asked me if I'm a Niddah, I would say, I don't think so. There's no reason for me to believe that you are.
No, and for such a woman, she's not a Niddah. Although there is an interesting discussion. I don't believe we've discussed this in the past. Maybe this will be another topic. Gynecological procedures and instruments.
Yes.
When that
really.
Yeah. So, there is a concept of the opening of the cervix to a point where we would say that a woman is a Niddah even without blood. And therefore, if a woman was 2 centimeters dilated, even that's an early stage. But let's say she was 3 centimeters dilated. Let's say she was 4 centimeters. So some poskim are actually machmir, and they say that not well if there's severe, intense dilation up to, let's say, 4 centimeters. So at that point, objectively, we would call her a Niddah.
Okay, but
some
here we didn't have it. She just walked in. She's not in labor and asking to be checked. So usually what I call this is a woman who had children.
Yeah.
They walk in, they could 4 centimeters. They had
Correct.
5 children and they're walking around at the end of pregnancy, 4 centimeters dilated.
Correct. So in America, the majority of poskim are makel on this. And even some Eretz Yisrael poskim assume that we're makel, that this woman, even though she is dilated to a certain degree, but that would not render her a Niddah. She would be fine. Okay, if she asked you medically, can I have relations? What would your response be?
Until you broke your water, I have no objection to that. So
even if they're in active labor, it might not be so.
No. This is again. She walked in, not in labor. She's been walking around. She might have been walking around that way for 3 weeks before she came in to see me. She wasn't examined before. She has 5 children. I see this on a regular basis. They're walking around 3 to 4 centimeters dilated.
Yeah.
So on. I'll just throw in from my exam. I happen to have looked at my glove. There was some bleeding on it. In my brain, it was because I examined her. I didn't go anywhere inside the uterus. I did go inside the cervix, and I wouldn't believe that blood. If she asked me if it was coming from the uterus, I would tell her no.
So at that point, we could be makel even on the blood.
No.
The difference between that and the case before is that in the case before, if she's in active labor, so then there's a reason for us to assume that maybe there would be dam from the makor. It would be dam
and that's where I would agree with that. And that's what
here she's not in active labor, and on the contrary, she has a cheskes tahara. She's not in active labor yet. She has her chazaka. She's a cheskes tahara. She's pregnant. She's what's called a misulekes damim. So a misulekes damim in halacha is a woman that's not expected to see blood, like a woman who is pregnant. If you'd have blood on the glove and you know for sure that you were particularly harsh, not on purpose or aggressive in the cervix, and that's where the blood is coming from, then I think, and you know for sure that the blood is coming from the cervix, then you could be makel.
Okay, so let's talk about the word for sure. She walked in my office. She wasn't contracting. She walked in my office. She didn't complain of any blood coming out. I examined her specifically, avoiding anything touchy. She doesn't want me to touch the membrane, strip the membranes. It's Friday afternoon. She doesn't want me to do something that might put it. And I gently examine her and know that I did not go into that uterus. And when I take my glove out, I see some blood on it. And I would believe this is not uterine bleeding.
If you wanted to be super machmir, would you look at her? Would you examine her to see if there's some cervical bleeding?
No, because I would assume that the blood was coming from inside the cervix and not on the outside, looking at the cervix itself. And it would make her very uncomfortable for me to do that. Saying if I had to put in a speculum at that point and examine.
Right. So this is our, don't look at the glove. Stop looking at the glove, Dr. Herman.
Okay, that's what we're going to do. Okay.
But I think there is a difference. There is a difference between a woman. This is actually written up in Sefer PUAH. This is actually written up. There was a discussion with one of the doctors in Shaarei Tzedek, and she spoke about this and the prevalence of cervical bleeding during these examinations. But that's all good. There's room to be makel, but again, not when she's in the hospital and when she's contracting and actively.
We're pre-hospital now.
Yeah.
So her twin sister walks in. The same thing occurs when I check her. She's 2 to 3 centimeters, but she's 90% effaced, as opposed to not being effaced. Now I'm telling her, oh, something must have happened to efface your cervix. This is slightly different in my mind than just walking around, because you had 3 babies before and you're walking around 3 centimeters dilated.
It's too early. It's too early for us to assume that she's in Niddah.
Okay, again, there's no bleeding. She didn't say she's in labor. It was just, wow, you're 3 centimeters and 90%. You're in great shape. You're in great shape.
Correct.
Okay, next. Instead of that lady who I just told you about with the 3rd baby, it's a woman walks in on her 1st baby. So I want to make the distinction between the 3rd baby and the 1st. She had to have done some labor to get there. Again, she's not in, and again, the halachic active labor. She's certainly not in the obstetrics active labor, but maybe, again, it might be remote from her going to the hospital, but something definitely occurred in the realm of labor.
No, I don't think that that's enough. Even so, it's not enough to render her a Niddah as a yoledes.
Okay, a patient comes in, a lot of 39-weekers walked in my office. A 39-weeker walks in my office, right? And she says, or she calls me and says, my mucus plug came out. Am I a Niddah? What's the story, doctor?
Before I answer, it's a very tricky question. Before I answer, let's ask you, give us a little bit of biology. What is the mucus plug? Where is it? Why is it there? And when does it fall out? And what does it look like?
Okay, well, we'll start with the end. It looks like a blob of mucus as opposed to water, right? If I poured a cup of water down your leg, that's what I tell patients, that's breaking your water. If mucus comes out from below and I go like mucus, it's even more tenacious than that, that's your mucus plug. Okay, when does it come out? Well, it doesn't necessarily come out. A lot of times we see that mucus come out just before pushing. So many people go to the hospital in active labor and they never see a mucus plug come out. Now, where does it reside? It resides in the cervix, not in the uterus, right? And it probably has some antibacterial properties to it. Certainly, we know that the cells of the cervix change and they become, again, more stretchy right before labor. When someone's not pregnant, the cervix sort of has the consistency of your nose. If you want to feel it, it's hard. As labor goes, the connective tissue changes and that cervix dilates and stretches, and that's what happened. And a lot of times the patient sees mucus. So this patient is calling me up. They're 39 weeks and they say, my mucus plug just came out. I said, are you contracting? No. Are you leaking water? No. And they say, doctor, should I go to the hospital? And I said, no, it doesn't really mean too much. It could be you go into labor a week from now. And they say, really? And I say, really?
Right. With the mucus plug is also, it's a very interesting halachic debate. We referenced the concept of the uterus opening up and rendering a woman a Niddah even without blood. Some poskim say if the mucus plug is thick in consistency, and when it was expelled, it forced the cervix to open a little bit. So perhaps that would be psichas hakever, and we'd have to be concerned that the uterus opened, or that the cervix opened, and that opened the uterus, and then she'd be a niddah. From what my understanding is, most of the time it's more slimy than it is thick, and generally speaking, we don't automatically assume that a woman is a niddah. The question is if there's blood in the mucus plug.
Okay, which is going to be my next question. The mucus came out, now there's blood with the mucus.
Yeah. So that is a machlokas haposkim. Some shittas hold that if there is blood in the mucus plug, then she's a niddah. And the truth is, there are many shittas that hold that if there's blood in the mucus plug, then she's a niddah. However, I remember seeing this many years ago. Perhaps it was even our first baby. Rabbi Binyamin Forst, in his Hilchos Niddah book, so he brings various opinions, and it seems from the top of the book, he has the top, the halachas, and then he has the footnotes in the bottom. So it seems he brings various opinions. I believe I have to look back, but he concludes with the opinion that a woman might not be a niddah because even when there's blood. And in the bottom, on the footnote, he writes, in consultation with doctors, it seems reasonable to assume that the blood is coming from the cervix and is not coming from the uterus. And therefore, the blood, even in the mucus plug, if there's blood, it would be considered dam maka, it would be considered a wound blood, a cut, and not dam from the uterus like we spoke about earlier. And therefore, la halacha, I personally am makel that even if they find blood in the mucus plug, there's certainly enough to rely on to assume that that's not uterine blood, but rather cervical blood, and would not render her a niddah.
But we did give the caveat that she's not complaining of contractions. She's not complaining of anything else. She's just
Even so,
it came out.
Even so.
Well, I think that if she does say, listen, I am contracting every 5 minutes and they're getting stronger, then I don't think anymore you could make that assumption that it's just the cervix, and not uterine anymore.
Okay. Again, to which I would respond, the husband calls, the wife calls, am I a niddah? Well, would I say she should have tashmish now? Maybe not. Can I give my wife a kiss? Maybe not. But can I help her into the car? I would be makel for sure.
Another 39-week pregnant woman calls, and she says, my water broke, but I'm not in labor. So water's running down her leg. There's no mucus, there's no blood, not in labor.
There are shittas that hold that the water breaking is the onset of labor. She's a niddah. Some poskim argue and say that's only if there's blood. If there's blood in the water, so then you'd have to be machmer. Dr. Herman, have you heard of cases of blood in the water?
So my next line here is a 39-week pregnant woman calls and says, my water broke, and the water is red tinged. Is that a common occurrence? Yes, but usually there's some labor that's accompanying it, so it comes out a little bit of blood in it. Right. So okay, at that point, if there's really blood that's accompanying the water breaking, given the fact that there are shittas that hold that the water breaking is also a niddah, so I think it's important to put all the pieces together and say, yeah, maybe I really am a niddah because I'm in active labor, but just the water breaking alone is not we generally assume is not a niddah, and there's no obligation to check to see whether or not the water came along with blood. Okay, but we do specifically look at the color, and on the phone, I will ask them what is the color of the water. We'll get to that in a minute, but before we get to that, let me give you a different scenario that instead of 39 weeks pregnant, the patient is 34 weeks pregnant. And she has preterm premature rupture of the membranes. She's not in labor. She broke her water, she comes to the hospital, and depending on when in pregnancy, we either will put her into labor, or if it's very premature, we'll watch her in the hospital, and she'll be there for days and days and days, making sure she doesn't get an infection and some other parameters that we're looking at. And she certainly was not in labor, and she gives birth 4 weeks after she broke her water. I'm not convinced that she'd be a niddah. I would ask the doctor if there's a way to determine where that blood came from. And
if there's any cervical bleeding, any vaginal bleeding or anything like that. I think definitely could be Mako.
Okay, so in light of
It might also depend on how much blood.
Yeah.
Meaning if we're talking about water with a slight reddish tint, that's different than a significant amount of blood.
Okay, but certainly if we looked under a microscope, we would figure out that those were red blood cells.
We don't. Halacha doesn't function under microscopic lenses.
Yeah, but that's what again would be our assumption. So again, a 39-week pregnant woman calls me on the phone, says my water broke, and I said, "What color is it?" And she tells me it's greenish. Okay, she has meconium in the fluid. It's not blood. We know that's coming. That's coming from the water that's in the womb. Does that do anything to a Niddah status or a Niddah?
According to most poskim, she's not a Niddah.
Okay. This we sort of discussed already. A 39-week pregnant woman on her first baby goes to the hospital, and sometimes she shows up 3 times before being admitted because it's very early labor. And she asked to be checked. She's 2 centimeters dilated. She's effaced. Contractions are coming every 8 minutes. She's sent home in early labor. There's no mention of any bleeding. Okay, she calls me. She's in Israel. I get these calls a lot. You know, I'm in Israel. I'm in labor. This is what's going on. A lot of times it's her mother that's calling me. You know, what is her status? And again, it comes back to that question of, you know, don't look and don't tell. Don't look at your underwear. Don't look at your, you know, at what's going on. Certainly she's in early labor. And again, we don't know when the line crosses over to what we determine as active labor.
Yeah, I mean, we have no indication that she's a Niddah.
Okay.
We have no indication that she's a Niddah, and on the contrary, she's a Misulekas Damim. Pregnant women generally don't see. She has a Cheskes Tahara. So we have a lot of things working in our favor. Now, when labor hits, so obviously our chazaka changes, our status changes, and we don't say, "Oh, I'm not going to see blood because I'm pregnant." That's ludicrous. But up until that point, unless we've identified a real point, she has the Cheskes Tahara working in her favor.
I'm going to ask you to help define a couple of words.
Okay.
Okay. So I read a statement when the water breaking doesn't render her Niddah, but it changes her status of a veset. Could we talk a little bit about what that means?
I think that was an opinion of Rav Mordechai Eliyahu, that he had a chiddush that similar to what I mentioned before, that nuanced approach. So that when a veset is when a woman is about to get her period, or she knows that she's getting her period, she's expecting her period. So the halacha has a special status with that period, that window of time where she's expecting the period. And the halacha of a veses is that they're not allowed to have tashmish. Let's say a woman expects her period today, within 30 days, she expects the period today. So on day 30, let's say. So she's not allowed to have tashmish, but physical contact is permissible. According to strict halacha, even hugging and kissing is permissible. The Shach mentions from a Bach that it might be a good idea not to hug and kiss, but strict halacha, it's permissible. So I think Rav Mordechai Eliyahu, who was the Sephardic chief rabbi of Israel, had this chiddush that this gray window of time, this gray window where a woman is in labor, but she might not be in active labor far enough to assume that she's a Yosheves Ala Mashber. So maybe that would have a status of a veses, where there would be an Isser Tashmish, but a heter to hug, kiss, or to touch, and perhaps hug and kiss. It's similar to what I said before, but putting a halachic, status on that window of time.
Right, I got that. Then I also saw, in regard to the mucus plug falling out, okay, that some poskim say that it's assumed that there's a psichas hakaver, or is it like a ketem? So just a little bit more definition of both of those terms.
So psichas hakever refers to that notion that if the cervix opens, so then objectively she's a Niddah. Okay, so there's different measurements. According to Rav Moshe Feinstein, it's 19 millimeters. So according to Rav Moshe Feinstein, if the cervix was open 19 millimeters, then even if there's no blood, so then she'd be considered a Niddah. So the question is it possible, do we think that when the mucus plug comes out, the cervix had to open 19 millimeters in order for that mucus plug to be expelled?
Again, in general, again, taking most first pregnancies, if they have a mucus plug come out, I don't believe that when they get to the hospital without contractions because they just showed up because they were worried that they would be 2 centimeters dilated.
Yeah.
So,
right.
you know, we invented no pain, no gain, especially with the first baby. It would be pretty rare for them to just be walking around, you know, even with a mucus plug come out dilated.
Right. So again, whether psichas hakever, which is the opening of the cervix, which is an assumption that the uterus also opened up. So that's a question whether the mucus plug would cause that to occur. If it's not that way, in which case she would not be an objective niddah, then we would treat it like a kesem. A kesem is just blood that comes out of the uterus or comes out without a sensation, without her feeling it. And the halacha there is if she sees it, let's say on white underwear, so if it's the size of a penny, then it could render her a niddah. If it's smaller than a penny, then it's not going to be a problem. It's not going to render her a niddah. So maybe we would treat this like a kesem, and we would look at the amount of blood. If it's larger than a penny or smaller than a penny, is it found on something white or is it on blue underwear, colored underwear, toilet paper, etc.? So it's a whole, you know, that you're going to go down that road of Techos Niddah, which I don't really want to get into right now.
A patient who's 39 weeks pregnant shows up in my office. She says, "Doctor, I'm uncomfortable. I can't take this anymore. I need to have this baby. I tried everything that I could try to get into labor. Could you strip my membranes for me?" And I say, "It's your 5th baby. I bet you if I do that in 3 hours from now, you'll be in labor. If that's what you really want, I have no objection. I'll be done seeing patients in 2 hours. I'll meet you in the hospital. When I'm done, I'm sure you'll be there by that time."
Okay.
On a first baby, if I did that, it probably, in loads of cases, it would not work at all. You know, stripping the membranes means I'm going through the external os, internal os into the uterus itself, and using my finger to separate the membranes from the sidewall of the uterus.
Right. So first of all, so the question is whether she's a niddah. Is stripping the membranes make you a niddah?
In and of itself. A lot of times I don't see blood afterwards. I don't look for the blood. I don't see blood, but I know, you know, what I just did.
Right. Now, this is a very good question. It was always assumed, and many still assume, that stripping membranes renders a woman a niddah. Period. Pun intended. Sof pasuk. That's it. She's a niddah. Recently, Machon PUAH in Eretz Yisrael has been doing a lot of research on this, and they say, wait, not so fast. Let's go step by step and examine what is actually happening here. The first question we have to identify is when you go in and strip the membranes, how wide are you dilating the cervix? Are you sticking 1 finger in, 2 fingers in, 3 fingers? What are you doing when you strip the membranes? Are we reaching that 19 millimeter window of Rav Moshe Feinstein, or is it smaller?
Okay, so in patients with a first baby, I would say, just for our discussion's sake, 1 centimeter. I could get my finger in and I wiggle it around to cause a little irritation and to separate the membranes. In someone with a 5th baby, they could be walking in already, they're 3 centimeters dilated. So before I start, they're already 3 centimeters dilated. And it wouldn't be unusual on a 6th baby that person who is 3 centimeters, when I examine them, I could probably stretch it to 5.5 centimeters.
Right.
It's so stretchy at that point.
That's a good point. So the starting point is many poskim assume that stripping membranes will render her a niddah. However, if you can strip the membranes in a way that you're not going to open the cervix more than 19 millimeters, 3/4 of an inch, and the bleeding that will occur from your procedure is minimal. She's not going to have a flow. If she sees blood, she may see a spot or two here and there. So there are poskim who hold that she would not be a Niddah. That she would not be a Niddah. You'd have to remove your glove without looking at it, but she would not be a Niddah. The question is, how common is it that you wouldn't that you wouldn't go into the cervix more than 19, less than 19 millimeters, and her not see any blood? So to answer the question, is she objectively a Niddah after you have stripped membranes? Many poskim actually say no. She's not an automatic Niddah. However, given the circumstance, often she will be a Niddah because of psichas hakever, because of opening the cervix. But if it's not open too much, 19 millimeters or 3/4 of an inch, like Rav Moshe writes, and the bleeding is not going to, and the procedure is not going to cause a real flow, it's only going to cause spotting. So then we would treat it like we said in that previous question, like a kesem, and she could ignore that bleeding. It won't render her any Niddah.
I would tend to think that the overwhelming majority of women who have stripping of the membrane will end up in Niddah due to one of those two reasons.
So I'm giving the halachic klalim, the rules. If in your medical experience, if this is what's happening and not all of them are met, so then then she would be a Niddah.
Just a quick statement for those who did not hear our discussion on induction labor. We talked about stripping membranes out of concern of should we, in what cases is it allowed? So we should refer back to our previous discussion.
Yeah.
I'm just going to do a little bit of a pivot now from Niddah before labor and in labor to a topic that's really important, which is the husband in the delivery room. Okay, and husbands come to the delivery room for two basic reasons. One is just to be there, and two is to be a labor coach in addition to a doula or the mother-in-law, the patient's mother, or in addition to the nurse. So they have two basic reasons why they're there. We know that they have to act appropriately when they're there. And I'm just going to throw that back to you and ask you, what's appropriate behavior of the husband in the delivery room? That's what the discussion turns to.
There's a question: how can we let more women join? I presume she means
she has a status of a Niddah.
Yeah.
Wife, right? There's the issues of Nagia and she can't touch her.
Right.
There's a prohibition outside of Niddah for always that he can't look down there. Always. And here you're in a delivery room with a baby coming out.
Right. Okay. So
what is the proper way for him to act? I'm going to give you 2 times during labor itself, and then during the time of pushing.
Right. Usually a woman, although she's just wearing her gown, she's usually covered for the most part. Her chest is covered, her arms are exposed. And then there's the blanket over her legs. So being in the room before she's actually pushing is not too much of an issue. While a woman's in Niddah, let's assume she's a Niddah, right? Let's assume that we've already spoken to all of our Rabbanim. Our Rabbanim have waited. This woman is a Niddah. Yeah. So there is a halacha when a woman's a Niddah, a man is not allowed to look at parts of her body which are typically covered. And now if she were to expose it, so that's inappropriate. However, there are many women that walk around the house while she's a Niddah in short sleeves. Right? When she wears pajamas, many women are wearing short sleeve shirts, and she'll continue to wear those short sleeve shirts even while she's a Niddah. And according to many shittas, that's acceptable because that's what she always wears. She can't necessarily expose more when she's a Niddah than if she wasn't a Niddah, but whatever her baseline is, then she can continues. So the arms doesn't doesn't really make such an issue. Now, the other parts of the body, the lower parts of the body that are typically covered, you're right, for the Niddah reason and the general reason of not looking at osamakum, at the vaginal area, is a reason for a husband to be behind the woman when she's pushing, as opposed to next to the doctor who is ready to catch that baby. There are shittas, to be honest, there are shittas that say that it's inappropriate for a man to be in the delivery room to begin with. Maybe some practice that in Eretz Yisrael, maybe some practice it in the States, but I think the majority of Rabbanim and the majority of Jews, even the modern Orthodox, and even more than modern Orthodox, I think the Rabbanim allow the husbands to be in the room, even during the pushing, just situated and standing in a place where he won't be exposed to the actual pushing. I do not think it's appropriate for the man to see the baby coming out. You should stand next to his wife and give her whatever support she wants. Sometimes the women want them to be verbal and vocal, and sometimes they just want them to be quiet. Don't say anything. Stop talking. So husband should listen to his wife, be supportive, but not to be looking at the vaginal area.
So we often turn the patient around, sitting next to the wife at the head of the bed, instead of looking towards my end of the bed, is turned around looking towards her head or even towards the window. During labor itself, most everybody stays in the room with their wife. I'm talking about yeshivish, Hasidish. It doesn't matter. No one's leaving the room. When it comes to the pushing part, my patients from Crown Heights, they all leave the room. And when I leave the room means there's a curtain that they'll go behind that they can't see anything at all. And it's actually a fun time after the baby comes out to make the wife tell the husband loud enough so he could hear through the curtain what they have. That's always a very touching moment. There are people who clearly they're instructed to just leave the room totally, and they go out to the hallway at the time of pushing. Yeah,
and there are those shittas. People should listen to their rabbanim. It's very clear. There's no isser for a man to be in the room while his wife is a niddah, or while his wife is pushing him. I don't think that there is any absolute isser. The question is, what's appropriate behavior? What's the appropriate behavior for a husband during it? And if that's the psak from some rabbanim, we respect it, and patients should follow the psak of their rabbanim. But if a woman if you ask me, if a woman wanted her husband to be there, or the husband wanted to be there, and they're not going to be exposed to anything which is typically uncovered, typically covered, or the vaginal area, I don't see any objective issue.
I think in practical life that the husband often needs to be reminded, because there's such an urge to look at your baby, like emerging.
Well, if you stand them, if you put them, say you stand there, right
you have to be very makbid to put them in a place where because all the nurses know when I tell the husband, your Rav called me, he said you shouldn't be looking in this direction.
Yeah.
They know already. They know already.
That for sure. That for sure. They shouldn't be standing. They shouldn't be standing next to the doctor.
Now, the last time we spoke about davening in the morning in the delivery room with your wife. There in labor. Comes the morning, you're looking at your watch. Zman Tefillah is coming. Zman Kriya Shema is coming close. And you want to daven, but you don't want to leave. And we talked that it's probably not appropriate to daven in the delivery room. Correct?
Yeah, correct.
So let me ask you this question. How about saying Tehillim for your wife while you're sitting in the delivery room with her?
At what stage? When she's pushing? When she's pushing?
She's pushing. I'd say turn around and say Tehillim. But it made me think when we talked last time about it's not the best place to daven. Like, should you be saying Tehillim in the room?
The only question is is it considered an area which is not clean? That would be the question is whether it be an area that's not clean. I think typically where this question comes up. It comes up where the Shulchan Aruch says that you make a bracha after the baby is born,
right?
Whether it's a Hatov HaMeitiv or a Shechianu, which is interesting. It's an interesting set of halachas. The Shulchan Aruch tells us to do it. The Rif and the Rambam don't mention it. So the Aruch HaShulchan really questions whether a person should be making that bracha. But anyway, so there the poskim have a discussion whether it's appropriate to make the bracha immediately upon the labor when like blood's flying all over the place. So a lot of the poskim say you should wait, clean up, things should be a little, it should be a cleaner room, more respectable to make the bracha, and then you can make the bracha and say Shem Hashem. So I would say the same thing.
Certainly, if I felt uncomfortable, like I'm in the middle of really in the middle of things, and the husband's making a bracha, he just a boy came out and he's making a tova ametiv,
I mean,
I go,
it's not probably,
whoa.
maybe not the most appropriate. At least maybe you should turn around. But I think the poskim recommend waiting a little bit, cleaning up. The bracha can be said as long as you're still you've captured that moment of intense joy and simcha, the birth of a child, a boy, a girl, whoever it is. But you don't have to make it, immediately toch kedei dibur, that 2-second window between the baby coming out and making the bracha. It doesn't have to be like that. It should be imminent, shortly thereafter. But it can wait until things get cleaned up a bit.
So getting back to that, should he be saying Tehillim in the room with her? How do we determine whether it's a clean room, whether it's, and in that same vein, patients bring Sfarim into the room. They put Noam Elimelech underneath the pillow.
Under the pillow, sure.
So it just made me think about that a little bit because of our last discussion.
I would say if he wants to do it, if a husband wants to do it, he should turn around. He shouldn't be facing his wife.
Certainly he's turned around. I don't know if you're aware, to every from patient who comes in, I give them Tehillim to say, and I give them Psukim to say. I'm physically hand them the pages, and I said, okay, say some Tehillim for your wife.
All right, very nice.
Okay, our last topic, that should only take a couple of minutes, it's now 10:04. Our last topic is cesarean section and Niddah. So I have patients, they have 4 babies, they're on their 5th baby. It's their 5th cesarean section. And we have it scheduled for 8 o'clock on Tuesday morning, Kitov. And no labor has ensued, no water has broken, no mucus plug has come back. And she walks into the operating room. She gets her spinal anesthesia. We lie her down on the table, prepped, and then we invite the husband to come sit with her at her head. And a plastic sheet goes up, so he cannot see what the operation that's going on, and he is holding her hand during at the start of this operation. When does she become a Niddah? Does she become a Niddah?
She becomes a Niddah when blood leaves the uterus. So it may not happen until the baby is removed.
Okay, blood comes from the uterus through my
out of the vagina, out of the vagina.
And we're not going to see that until after the delivery is done. We
Correct.
will not see that blood.
Correct. But blood will leave the vagina.
Correct. After the baby is delivered and the placenta is removed, certainly there'll be blood that's coming out through the vagina.
Yeah. So at that point, a woman's a Niddah, meaning just taking the baby and removing the baby from the C-section objectively will not render her a Niddah.
It's when I remove the placenta.
Yeah. Then at that point, the blood will leave the vagina. Then she would be called a Niddah. Now, it's going to be very difficult for them to pinpoint that. So therefore, I would not recommend him continuing to hold her hand, right, until that point. Once baby comes out, for all intents and purposes, I would say they should assume that she's going to be a Niddah shortly thereafter.
I guess my question is the baby comes out and it's their 5th baby. It's their first daughter after 4 boys. And he says, Mazel Tov, and he gives his wife a big kiss before the placenta comes out. It sounds like.
As long as the blood hasn't left the
until we've separated that placenta, it's my belief that there's no blood. Okay, correct. So last question. Now, unlike previous, the husband is allowed to stand up and watch the baby be delivered through the cesarean section. Shouldn't be a problem.
He wants to, yeah.
Well, they encourage them now to. Do you want to stand up? Stand up. Watch the baby come out. So,
Yeah.
okay.
That's pretty cool. I should do that. I would want to do that.
No, you don't want to do that. You would like
I would
that
want to see it. I
deliveries
want to
without
see it.
complications.
I
Okay.
would want to see it.
Yeah.
I would want to see it.
Listen, on YouTube, you can watch everything. So if you want to send you, I'll find that video for you. That's for sure. Good.
Very good.
Any other thoughts before we wrap this up?
I think a good closing message is the message we began with. What's the answer to the question of when does a woman become a Niddah when she's in labor? Very hard to tell. There is no actual precise answer. The whole discussion is ambiguous. It's vague, leaves a lot of room for different psakim from different rabbanim, and I don't think it's. I think it's important for rabbanim to exercise the various psakim that are available and to recognize what is each woman's situation, which couple's situation, and to give the appropriate psak based on the couple, based on their situation, based on their labor and their history, and with the doctor's advice. So it's definitely not a clear-cut question, definitely not a clear answer. Someone just asked a good question. Can the husband cut the umbilical cord?
So I'll give you my first response and then I'll ask you. I say 9 out of 10 rabbanim say the husband could cut the umbilical cord. That's where I'm holding in my personal discussions with rabbanim. So now I'll let you answer.
Okay. I think that I always wonder whether it's the same shaila if the woman's in Niddah and she's holding the telephone at a time where telephones had cords, those spiral cords, if the woman's holding the phone and you need to go under the cord, are you allowed to pick up the phone cord and go under? It's a taz in Hilchos Niddah that that talks about the Giya al yedei davar acher. I'm not touching my wife, I'm touching her through something else. So there are machmirim and there are mekilim. In the case of need, we allow a woman to touch his wife al yedei davar acher. Generally speaking, we're machmir. So I always question if the placenta is inside, everything is still inside and it's part of her, and it's her. So it's an extension of her, and you're cutting the cord. It's essentially negiah al yedei davar acher. If there's no reason to do it, which I'm not sure what exactly the reason is, why the husband would want to do it, or would.
Well, he wants to participate, but I'm going to tell you what we have a little workaround that we've been using.
Yeah.
Which is I often have the wife cut her own umbilical cord, or I have her mother, if her mother is there, do it. And then when they take the baby over to the warmer, there's still a little length of cord that usually the nurses will trim it off. We have the husband come over to the baby in the warmer and cut that piece of cord off. Again, because we like him to participate, and they come back to us and they say that was really nice. I really appreciate it.
Fine. What about if it was on Shabbos? What happens if it was on Shabbos?
Okay, so tell me, if it's on Shabbos, could the wife cut her own umbilical cord? Could the mother-in-law cut the umbilical cord?
I remember a guy asked me a shayla. He says, "Am I allowed to?" He said, "I feel bad. Are you allowed to cut my wife's umbilical cord?" So at the time I just had a baby. I said, I was thinking the same shaila. And so I said, maybe it's better not to. So he said, "Oh, I did it. I feel bad." I said, "You don't have to feel bad." I said, "The truth is, I had the same shaila also, but it wasn't really nogea because it was Shabbos. So I didn't do it because it was Shabbos." So he said, "Oh, mine was also on Shabbos." All right, fine. Anyway, I think it's best to avoid both on Shabbos, both on the weekday. I don't think it's a good. You don't have to get involved. I like your idea. Have them completely separate the cord, and then if the husband wants to participate, he'll participate, but it's completely detached from the woman.
I saw a question go by 1 second ago. If the woman can't walk due to her epidural, does that change her status in any way?
I don't think so.
A lot of times what we do is I call them designer deliveries. The patient's overdue. It's her 5th baby. She's a week and a half overdue. She goes, I ask her, "Are you going to have an epidural?" And she says, "Yes." I said, "I'm going to give you that epidural before any pain starts." So if certainly she isn't in labor by the time I'm giving her epidural.
Right.
Would this recording be available? The answer is going to be yes. In the next couple of weeks, I think we have to sit down and figure out where we're going to post them, because The requests for us to post them are coming very, very quickly. And this is, I think, our eighth share that we've talked about. So we have all of those to post. We just have to figure out where we're going to do that. Thinking a little bit about YU Torah, thinking a little bit of just put them up on YouTube, and any other suggestions we'll entertain, because we haven't really drilled down yet, where we're going to post them. But I think there's such a need and people keep requesting it.
Yesher koach.